She's back by popular demand. She's Heather Howard, former state commissioner of health in New Jersey and also a lecturer at Princeton University's Woodrow Wilson School of Public and International Affairs. Good to see you, Heather.
Thanks, Steve.
You're the smartest person I know on healthcare, which is a setup for the question. Okay, presidential thing going on. Okay, we don't know what's going to happen, but I do know this. Medicare for all is being talked about a lot. What is it? What the heck does it cost?
Well, numbers as high as it should. So everybody's talking about Medicare for all, which maybe isn't the right question to be talking about.
What is the right question?
I think we ought to be talking about costs, because everybody in America is struggling with healthcare costs. Nobody thinks that we're getting the value we should be for what we're paying for in healthcare.
Okay, so if Elizabeth Warren says, hey, Medicare for all, just tax people who are the wealthiest, will not affect the middle class. When you hear that, is there a party that goes, really?
Well, there's two issues. One, it's, easier said than done, right?
Go ahead.
We can talk about...
Or it would have been done.
Can you imagine, the concern I have is we haven't thought through the potential disruption, right? It means half of the country has health insurance through their employer.
Yeah, what about if I have my private?
You would be transitioned onto a Medicare plan.
Would I be forced?
Yes, within a number of years, yes.
Is that why some say, how about Medicare for those who want it?
Right. So some people say, well, how about Medicare for all for those who want to buy in? I think it all boils down to, do you think our current system's working and we should just maybe patch it up where it's not, or should we tear it down and start again?
And you say, as an expert on the subject?
Well, I think history has taught us that we get further when we build on what we have and we move incrementally. I don't know that there's a public appetite to throw everything out. And is there going to be a majority in the Senate to do so?
You mean a majority
of people who would support throwing the current system out?
What is the president appears to say, President Trump, as we speak, appears to say, let's throw the whole thing out. Let's throw the Affordable Care Act out. Obamacare, throw it out. Do you think he understands what that would mean?
I don't think he's appreciating how disruptive that would be and how politically disruptive that would be for him. I think he sort of gets it when he says, we'll do it after I'm reelected. Well, what does that say? Then that means, right, I don't want to do anything between now and then, is a recognition that this would cause a lot of people a lot of pain if they have to change what they're doing. Yeah.
So interesting. The whole question of the Affordable Care Act, you and I were talking right before we got on the air. I don't want to confuse things, but part of the reason we do this program is to try to break things down and explain it. And that's why we always love having Heather here, because she can talk in very practical terms. There is a federal healthcare exchange. There is a state healthcare exchange. Consumers, people watching right now, can they go on either one of those? Healthcare.gov, go on, that's the federal site. It wasn't working for a while in the beginning. Now it does. Can you go on either one and sign up for insurance?
Yes. You can go to healthcare.gov. We're in open enrollment now.
Okay.
So
as we do this program in the middle of November. But go ahead.
Yeah, so they can go on healthcare.gov. Now, but you're right, the Affordable Care Act lets states operate their own exchange if they want to. And
why?
Well, because the theory was that states have different perspectives. The healthcare markets are very local.
So let's have more competition? Is that what the argument was?
That California can do it in a way that meets California's needs better, and Governor Murphy thinks that New Jersey can do it differently. And so this time next year, will be opening a New Jersey marketplace. He's saying, look, I don't want the federal marketplace. I want New Jersey to own this, because I think we can do it better.
Does that make sense?
I think it does, because we're now paying more, given the size of the state, we're paying the feds more to do it for us. And we can do it better with that money. Keep it here in New Jersey, do more advertising, target it to populations here.
Excuse me for interrupting. By the way, if you're listening on the audio side, Heather Howard, former commissioner of health in the state of New Jersey and also a lecturer at Princeton University on these subjects. Fair to say that the federal government cut back on the dollar. You could say advertising. Advertising, particularly for those of us in the media, is a euphemism for public awareness. They're like, listen, we can't do away with the Affordable Care Act, Obamacare. I'm not going to spend a whole lot and let people know about it.
That's right. So you have a president now entrusted with implementing a law he doesn't support.
Yes.
And so some people call it sabotage. She said, I'm not going to fund outreach. I'm not going to advertise the Affordable Care Act. And what's the risk of that? Is that means fewer people are signing up. And it's particularly risky because sick people will sign up for health insurance because they know they need it. But we need healthy people to sign up for health insurance,
Explain to
too.
people why it's not just younger, healthier people, but they happen to usually be healthier. Why do we need healthier people on, and what does that have to do with insurance rates?
Well, because basically, insurance is about spreading risk.
It's a big pool.
That's right. It's about spreading risk, and you want as many people in there sharing the costs so that when somebody gets really sick, there's enough money to pay for those costs. If only sick people buy health insurance, there's not enough money in the system, or you have to charge really high premiums. If a broad swath of people are buying health insurance, and especially healthy people, and arguably not using it, then that means there's enough money in the pool.
So Heather Howard, why is the number of uninsured people in New Jersey rising?
Well, I think partly because there's been this sabotage from the federal level. They said we're not going to advertise, and that's partly what Governor Murphy's responding to. He's saying, okay, I want to take back control, so we will advertise it. We will let people know when open enrollment is. We will make sure they know what plans are available, and so that's the tension here.
You know, you and I have had this conversation many times, and I'm going to put it this way in the time we have left. If someone says, hey, let's just fix the healthcare problem. You laugh when I say that.
Yeah.
There isn't a fix.
There's not a fix. I like to think in 1948, Harry Truman tried to do universal health care. At that time, health care was 4% of our GDP. Now it's 18%.
4% to 18%.
Of our GDP.
Am I wrong that Richard Nixon actually tried to do something?
He did too.
And actually pretty progressive stuff.
Ted Kennedy used to say that one of his biggest regrets was that he didn't cut a deal with Nixon. We could have gotten universal health care with Nixon.
Wow.
And it wasn't good enough at the time, but it would have been better than where we are now.
Then Hillary Clinton, when she was first lady, and then all these iterations.
So finally, Obama makes significant progress, but we're backsliding now and losing ground. And I really think once it's 18% of the GDP, how do you reorganize a fifth of the economy?
I don't know, but we're going to keep asking Heather Howard. Thank you, Heather.
Thanks.
Stay right there. I'm Steve Adubato. This has been State of Affairs. Thanks for watching. I'm out of breath. We'll see you next week.
What can great minds do?
While at Seton Hall, I interned with the Superior Court of New Jersey, and that inspired me to go to law school.
I am a physics and civil engineering major, and I want to work on infrastructure in underdeveloped countries.
I'm the news director at one of the top college radio stations in the country.
I'm working with my professor on research that could help athletes during sudden cardiac events.
I started my own business, Classic Soccer Cleats, and I just sold it to a company in England.
Come see for yourself what great minds can do.
Also brought to you by Holy Name Medical Center. This place is different. The Turrell Fund, supporting right from the start NJ. International Union of Operating Engineers, Local 825. And by Airbrook Limousine, serving the metropolitan New York, New Jersey area.